Hello everyone, it's me Dr. Ayaz Ahmed. I am working
Sorry,
as an
I can't
aesthetic
tell you all of your
dermatologist.
updates right now.
Today I will discuss another important topic of dermatology that is actually a continuation of last topic. The name of topic is clinical variant of adenomatous behcet disease. The clinical variant are two. Number first is the mucocutaneous lesion, another one is the systemic lesion. Those variant which involve mucocutaneous lesion, these are recurrent ophthal ulcer in 80% of cases and genital ulcers. Oral ulcers usually heal without scarring in 92% of cases. Genital ulcers heal by scarring in 64 to 88% of cases. Oral ophthal ulcer may lead to dysphagia, dysphonia, fistula formation. It usually involves larynx, trachea, and esophagus. Genital ulcers usually occur in penis, scrotum, labia, anal and perianal and inguinal area. Now systemic lesion. This variant is characterized by venous occlusion and varices, arterial occlusion and aneurysm, involvement of large vein and aneurysm of large artery, involvement of pulmonary, cardiac system involvement including coronary arteritis, myocarditis, endocarditis and valvular disease. Renal involvement include glomerulonephritis, GI involvement include perforation and peritonitis, CNS involvement include severe headache, meningoencephalitis, cerebral venous sinus thrombosis, intracranial hypertension, cranial palsy, gait disturbance, diplopia, hyperreflexia, ataxia, and positive Babinski sign. Now, let's come to differential diagnosis of adenomatous behcet disease. The differential diagnosis include oculocutaneous or mucocutaneous syndrome, erythema multiforme, exudativum, and variants including Steven-Johnson syndrome, Vogt Koyanagi-Harada syndrome, reactive arthritis, bullous autoimmune disease, pemphigus vulgaris, secretarial disease, mucous membrane pemphigoid, epidermolysis bullosa acquista, viral infection including herpes, Coxsackie and ecovirus, syphilis, and articulomucocutaneous syndrome. All these are the differential diagnoses of Emmentaler's behcet disease. Now complications. Complications include blindness, meningoencephalitis, hemolysis, intestinal obstruction, peritonitis, severe arthritis, CNS and pulmonary and large artery involvement and bowel perforation are the fatal complications of disease. Investigation. There are two main investigations of adenomatous behcet disease. Number first is the pathology test and second is the radiological finding. Pathology test is hypersensitivity reaction represents as erythematous papule or nodule greater than 2 mm at a skin needle prick site. 0.1 ml of isotonic solution, salt solution, is injected via 20 gauge needle without prior disinfection of needles of injection. Angle usually used is 45 degree and given 3 to 5 mm intracutaneously on volar aspects of forearm. Results are erythema without infiltration or injury are supposed to be negative, while provoked ophthus or genital ulcers after injection are supposed to be positive. Always note that Positive pathology test does not necessarily mean a positive result. It may also be seen in other diseases as well. For example, pyoderma gangrenosum, rheumatoid arthritis, Crohn's disease, and genital herpes infection. Radiological finding are arthritis. Moreover, MRI shows brain atrophy. Now, let's come to treatment of ophthalmic ulcer. The general treatment include mild diet, avoidance of hard, spicy, and salty nutrient, and irritating chemicals such as toasted bread, nuts, oranges, lemon, tomatoes, spices, alcohol or carbon dioxide holding drinks, mouthwash and toothpaste containing sodium lauryl sulfate. An association of smoking with a decrease of reoccurrence of oral ophthalmic ulcer has been noticed. Topical solution. The topical solutions are caustic solution. These include silver nitrate 1 to 2 percentage, tinctura myra 5 to 10 percentage weight by volume, hydrogen peroxide 0.5 percentage, and methyl violate 0.5 percentage. These are used once or twice a day. Another topical treatment options are antiseptic and anti-inflammatory preparation. These include Amlizanox 5 percentage in oral paste form given QID. Second is the triclosan 0.1 percentage mouthwash solution and in paste form. Third is the amyloglucosidase and glucose oxidase containing toothpaste. Fourth is the hexadine 1 percentage. Fifth is the chlorohexadine 1 to 2 percentage mouthwash solution. Seventh is the benzidamine chamomile extract, and eighth is the 3 percentage diclofenac in 2.5 percentage hyaluronic acid, and ninth is the hyaluronic acid 0.2 percentage gel. 10th is the tetracycline mouthwash for 2 minutes and it is given for 4 to 6 times a day. And last one is the minocycline, which is formed in 0.2 percentage in mouthwash. Moreover, doxymycin is also given in a isobutyl cyanoacrylate form. Moreover, corticosteroid, for example, triamcinolone, mucosal cream, ointment or paste 0.1 percentage, dexamethasone mucosal paste or solution 0.5 milligram per 5 ml, betamethasone pastilles QID or during night in ointment or paste form, intrafocal infiltration with triamcinolone suspension 5 to 10 milligram per ml, 0.1 to 0.5 ml per lien are given. Anesthetics include lidocaine 2 to 5 percentage, mepivacaine 1.5 percentage, tetracaine 0.5 to 1 percentage gel or mucosal ointment given 2 times a day or 3 times a day. Another is the 5-amino salicylic acid 5 percentage cream form given 3 times a day reduces the duration of lien and pain intensity. Cyclosporin 50 mg solution as a mouthwash given 3 times a day is effective as topical immunosuppressive drugs. Sucralfate suspension 1 gram per 5 ml given 4 times a day for oral ophthalmos and genital ulcers. Small randomized double blind placebo controlled trial again given importance to placebo. Thank you very much. Stay connected and subscribe my YouTube channel.